Good afternoon, and thank you for joining us for our Friday Posturite webinar. I'm pleased to say that today we have a very topical webinar to deliver to you on obesity from an employer's perspective. Graham is going to be presenting it today, and Graham is the Senior Health and Safety Consultant for AXA. And as I say, it is very timely because, as I'm sure most of you saw in the news yesterday, they're now telling us that a third of the world's population are obese. So we're hoping to learn a lot today. If you do have any problems with the webinar, please just remember that this will be put on our website for you to listen again at another time. So don't panic and listen again later. Also, on the right-hand side, you will see a questions box. If you have any questions during the webinar, please feel free to type them in there, and I'll get to as many of them as I can afterwards. So really, without any further ado, Graham, over to you, and we look forward to hearing what you have to say.
Thank you very much, Catherine. Good afternoon. This is a perspective on obesity from an employer's point of view. Just a little bit about myself. I've been a health and safety consultant or working as a health and safety manager for the last 22 years. Worked with AXA since 1996, and in general we conduct a wide range of risk assessments and audits, but a lot of them are health and safety audits of premises, health surveillance needs assessments, because AXA PPP do health surveillance with nurse visits, so I will visit a client and actually assess what tests need to be done, and job risk analysis, where we look at an individual, particularly when they're coming back from injury or illness, and helping them re-engage with the workplace and seeing if there are any reasonable adjustments that need to be made. The aims and objectives of today's webinar are to improve the awareness of problems associated with obesity, to give examples of obesity in the workplace and the issues that arise, to clarify issues linked to risk assessment, and looking to the future. Before we go further with the webinar, I thought I should give a health warning that this may contain the word fat at times. If you are easily offended by this word, switch off now. At my age, I struggle to be PC on many occasions. The webinar does not have all the answers and is likely to leave you with more questions than answers. It is a very new field, and there is still a great deal of grey areas. And if you're hoping that obesity in the workplace won't be a problem for you in the future, avoid any further distress by placing your head in a bucket of sand. Who is obese? Well, obesity is a medical condition in which excess body fat has accumulated to the extent that it may have a negative effect on a person's health. The negative effects are many and varied. The definition of obese is not internationally agreed, but in Western society, a calculation based on body mass index, or BMI, helps define obesity. And BMI is a person's weight divided by the square of their height. For instance, in the Far East, the BMI is calculated by a lower calculation. If a person's BMI exceeds 30, then the person is classified as obese. If they exceed 40, then it becomes morbidly obese. The World Health Organization definitions are listed that less than 18.5 BMI is underweight, and then you'll see from the chart there that the ratings go normal, overweight, but they don't then go into morbid obesity. They have class 1, class 2, and class 3. Greater than 40 is class 3, but at the moment these aren't internationally agreed. A few facts on weight. Art dating back 20,000 years depicts people who are obese, so we're not dealing with a new problem. In 2005, the medical costs attributable to obesity in the United States were estimated at $190.2 billion, or 20.6% of all medical expenditure. The specialized sector of medicine that deals with obesity is now termed bariatric care. And in 2014, the Lancet reported that there are now 2.1 billion people classified as obese. This is up from 875 million in 1980. No single country has succeeded in solving the problem. And at least 1 in 4 of us are trying to lose weight almost all of the time. And by the age of 45, the average woman will have been on 61 diets. The American Medical Association have now defined obesity as a disease. And you'll see as we go on, it's this definition of a person's weight. How do you class it? Is it something that you can help them with? Is it something that they have control over? This is one of the grey areas. But let's not get bogged down with the term of obese, because BMI figures can be misleading. For instance, if you use the calculation, then most of the front row of the England rugby team are classified as obese. A person's overall weight is a better starting point when you are talking about taking action on a background of health and safety. The limitations of the infrastructure and ergonomics of a workplace can be defined by the maximum weight loading permissible. So the maximum weight loading can apply to furniture, ride-on equipment and vehicles, access equipment such as ladders, structures such as scaffolding, and all of these will be affected by a person's weight. And you may have to look around the workplace and say, does this employee's weight exceed some of the stated maximum loadings? And we have a duty under the Health and Safety at Work Act as an employer to provide a safe place of work with safe access and egress, ensure a safe working environment with adequate welfare facilities, provide safe plant and safe systems of work, particularly applicable to providing safe plant, so ladders, chairs, anything, equipment must have the right weight capacity, and ensure safe handling, storage, maintenance and transport of work articles and substances. But of course the Health and Safety at Work Act, which has recently passed a milestone, has a very important sector that doesn't just apply the rulings to the employer. All the previous Factories Act, offices, shops and railway premises kept hammering away at the employer's duties, but the Health and Safety at Work Act was very important in that it defined an employee's duties. And Section 7 says that an employee must take reasonable care of their own health and safety and that of others who may be affected by their acts or omissions, and they must cooperate with their employers. So the taking reasonable care of their own health and safety is quite an important factor when you're looking at weight gain in an employee. They must also not intentionally or recklessly interfere with or misuse anything provided in the interest of health, safety and welfare. The employee's role in health and safety, it can be defined quite easily when I go around doing audits and I might come across a piece of equipment such as the fan that's shown. The manager of the office where I found this piece of equipment said, it's okay, only one person ever uses it. It's a misconception that it's okay for that one person to accept the risk. The management are responsible for their health and safety and so shouldn't allow equipment like that to be in the workplace. And the employee under Section 7 shouldn't place themselves at risk. Again, a very poor workstation, management misunderstanding of, well, it's his workstation, so if he makes it bad, then it's his own fault. It is the employer's duty to provide the safe place of work and the employee to work safely. An example in a bus garage where the sink was in, as you can see, a pretty filthy condition. But the manager's view was that the employees left it like that, so it's their problem. And here we see some examples of some wonderful electrical work. This one is a plug that has no switch, and an employee has plugged in a radio direct into 240-volt supply. It's got a 30-amp fuse on that socket, so if you get hold of the radio with a wet hand, you really wouldn't stand a chance. And the same with another radio. Radios and kettles and other bits and pieces that sometimes get bought from home are the biggest culprits, and these are the sort of things that I find. Somebody once asked me how I staged these photographs. They're by no means staged. They are simply naturally occurring in the workplace. And people will get round rules and regulations. This is a council where the rule was only one plug per socket. So some bright employee has decided that if he puts 3 appliances in one plug, then he's complying with the rule. But if you were shown this as you're doing a health and safety audit and you find an employee sitting using some furniture, would you appreciate it as a hazard in the same way as the picture on the left? The electrical plug is glaringly obvious, but looking at something like that might not immediately spark off the idea that you have a hazard in the workplace. Is the employer responsible for somebody who is overweight? Well, under the Health and Safety at Work Act, the employer has that legal duty to provide a safe workplace. Under the Equality Act, the employer must treat all employees fairly. And under the Equality Act, obesity is not a defined impairment, although health issues that arise from the person's weight are very likely to be a physical impairment. So, as a result of the overweight, they can be breathless, they can have type 2 diabetes, they have mobility impairment. These are all things that would need to be considered under the Equality Act, but not the obesity itself. Exclusions from the Equality Act include an addiction to alcohol, nicotine, and illegal drugs, but not food. Can a person become addicted to food? A recent article on Radio 4 listed that when you're trying to take somebody off of nicotine, alcohol, or drugs, the ultimate aim is to take them completely away and to abstain from any of that. If you have a person who's addicted to food, how can they abstain from actually taking food? So we'll look at a couple of case studies that I've come across in my time. The first is in a heavy industrial setting. It was an AXA client and they requested a job risk analysis, and it was for an employee who was thought to be in the region of 36 stone. All the figures quoted are in imperial because I'm of the age that I remember imperial better than I do metric, but I've added in the metric ratings. So his BMI was estimated at between 60 and 65. When we say estimated, you will find that one of the things that is hardest about dealing with the weight issue is actually getting a defined weight from the employee. The employee worked as an electrician in an industrial location, and his weight on joining the company some years ago was thought to be in the region of 19 stone. And the assessment looked at what tasks an electrician was likely to need to do, where they would need to go on a large industrial complex, and the risks that were faced by an average employee. We then aim to give a report that says an average employee should be able to do the job, but this person's disability has XYZ effect. The assessment looked at the person's disability or health condition and whether it has a significant impact on the risk factors. And so, using a simple item of furniture, such as this chair which came from the canteen, this one's the canteen chair, the previous was a chair that was used in the electrician's workshop. Both of these are limited to the amount of weight, and there had been instances of the chairs failing. There were access ladders around the location, and they were also doing some temporary construction work, and so there were temporary bridges, access bridges. And as I say, defining the maximum weight limit was easy because it's actually written on a tag on the scaffolding, or it's written on the ladder. However, for vehicle manufacturers, they are less forthcoming about their maximum weight loadings. I have had long discussions with a number of vehicle manufacturers, and they are very reticent to actually give you the technical data that says their vehicle will not take more than X amount of weight. The employee had to use a range of passenger lifts to gain access to upper floors because it was a very large commercial site. And when he was carrying his toolbox, the combined weight of his toolbox and himself meant that about 50% of the lifts on the site could not be used. They were fairly small personnel lifts, maximum of 2 people, but when you looked at the actual weight loading, he was unable to use them. The employee would be required to work in parts of the site that were undergoing extensive building work, and the temporary scaffold bridges had been installed to get between the new site and the old, and the employee's weight exceeded the maximum weight loading for the pedestrian bridges. It then means that about 50% of the site was out of bounds to him. And the employee's mobility was impaired, and he'd been allocated mainly workshop tasks. When he was seated at a metal bench, he would exceed the working limit of the chair that had been provided for him. The employee's weight also resulted in damage to local amenities, such as toilet seats, canteen chairs, places where he would go during his working day. The employee would normally be required to work from ladders and step ladders because, as an electrician, boxes, light fittings, etc. would be above head height. But his weight exceeded the maximum safe loading of even the largest of industrial ladders. There are many people who don't realize that ladders do have a weight loading. They used to be class 1, 2 and 3, and 3, for instance, was a hobby ladder which had a maximum weight loading of 95 kilos. There was also a number of confined spaces where the employee had to work, tunnels and ducts where he would have had to go and work on electrical junction boxes, and getting access to these was a considerable problem. We also realized that if he became a casualty or ill, when he was in one of these areas, extracting him would have been almost impossible. Access on the site between levels would require a person to use fixed ladders, as we showed in the earlier picture. These have safety hoops, which are a requirement to avoid people falling from the ladder, but unfortunately the employee was too large to fit through the hoops. Under the requirements for first aid, an employer needs to have an adequate arrangement in place. On consultation with the local health authority, it was found that moving a person of 36 stone would require the combined efforts of the paramedics and the fire service, with potentially the involvement of site lifting equipment. When I spoke to the health authority, they said the paramedics' duty would be to preserve life and stop the person's condition from deteriorating, and then the secondary feature is if they need to go to hospital, how do we manage that? They said that in industrial settings they have in the past used forklift trucks to move people into an ambulance. There is limited access to bariatric ambulances in the region. As far as I know, there were only 4 for the whole of the health authority, and there was also likely to be complications in finding a suitable bariatric bed within the authority. And so, although the person was working very close to a city centre, he could be moved up to 100 miles away to another location because the beds in the local authority would be full. The recommendation made was that the company should consider limiting all of the employees' work to a single area, for example, the workshop, and to provide a suitable chair for when he was working in the workshop, one that had a weight limit of at least 250 kilos. Work on ladders would be banned, and the company would have to have a contingency plan for what to do in the requirement of first aid provision, were the individual to become unable to walk or to move. There were also handrails and guardrails in the immediate vicinity of the workshop that would need to be strengthened, because if he needed to brace himself as he was going up and down stairs, the existing handrails wouldn't have put up with the strain. The employer also needed to write a personal emergency evacuation plan, or what's known as a PEEP, which is required under the Regulatory Reform Fire Safety Order. I've completed a number of these for disabled people, but it needed to be done for someone who had mobility issues such as this gentleman. If the cost of the equipment was too high and the restriction on using his skills elsewhere on the site were unmanageable, then the employee's future with the business would need to be considered. When we write these reports, we can't say you need to get rid of this person or you need to do something specific. We point out all of the various restrictions that are going to be in place, and it's then for the employer to decide if a reasonable adjustment can be made. The employee was permitted to use a works van to travel to and from work. The employee's colleagues explained that they had trouble fitting behind the wheel. Under the Road Traffic Act of 1984, a driver has the responsibility to avoid driving if a medical condition or medication is making their driving unsafe. They are required to inform the DVLA about their condition, and failure to do so can lead to fines of up to £1,000 and a prosecution in the event of an accident. However, for any of you who may have ever tried to convince an elderly relative it's time to give up driving, people are very wary of admitting that they have an eyesight problem or something that is impairing their driving, and this person certainly had not informed the DVLA that they were at risk. The second, excuse me, the second case study is in an office setting, and again an AXA client asked for assistance with completion of an accident investigation. An employee had been seated at a desk when the chair had failed fairly catastrophically. It didn't bend and slowly sag, it went very, very quickly, and the person was thrown to the floor. The employee had been thrown to the floor because the 5-star base of the chair had snapped. The investigation showed that the chair was only rated at a maximum of 18 stone, and the employee, again an estimation, was in the region of 26 stone, and the chair base had failed under excessive load. Further investigation showed the employee used other seating that was unsuitable. The seating in the canteen area, there was a training room on an adjacent floor, and also would at times be required to sit in her manager's office. The immediate solution was to provide a suitable chair for her to use whilst at her desk. This was not an issue, and the employer felt that the cost would be acceptable. However, the recommendation that the chair should then be taken around the site to all other locations was met with some reluctance by management. They were worried that they were going to single this person out and that the movement of the chair between rooms was going to embarrass them. Common problems when dealing with obese and overweight employees is a reluctance on the part of the employee to be honest about their weight, and getting an accurate figure is key to finding a solution. If you're letting them use a ladder that is rated, you must try and find out what that figure is, because then you'll know if it's a suitable piece of equipment that they can or cannot use. There's a reluctance by managers to deal with the issue. It involves embarrassment, potential HR involvement. Managers may also be keenly aware of their own weight, so that asking an employee or telling an employee they're overweight will usually get the response of the pot calling the kettle black. Weight gains and losses make the situation fluid and ever-changing. An employee could be assessed as being within safety margins, but over a 6-month period may exceed the safety parameters of the furniture and equipment that they use. The issue does not happen suddenly, and it only becomes noticeable over time. Taking action can often be delayed until an accident happens, by which time it is too late. By the time an accident has occurred, the employer will be in breach of their duty of care. The legal view. Well, the Daily Telegraph carried an item earlier this year. Fatness may amount to a disability for the purposes of European Union equality at work legislation. Europe's most senior legal advisor has warned employers. And it surrounds a case which is currently going through the European Court of Justice. It's because a Mr. Carsten Kaltoft, a Danish childminder, claims he was sacked by his local authority employer in Denmark because he was so overweight. It was stated he was unable to bend and tie the children's shoelaces. The Danish local authority that employed Mr. Kaltoft fired him amid reports that the 25-stone man was so fat he required help from colleagues to tie up children's shoelaces, and the employer was the controversial opinion that clinical obesity is a self-inflicted functional defect. The case of Mr. Kaltoft has been referred to the European Court of Justice, and they're expected to give a ruling soon. I did check this morning in case the ruling had come out, but no, they're still sitting on the ruling. But the head of the European Court has given an indication that he is significantly, I forget the term now, but he's basically giving a heads up that he's going to agree that it was a unfair dismissal. All lawyers involved in employment law are awaiting the outcome very eagerly. As in most legal issues, if mitigation can be proven, the outcome is likely to be less severe. If an employer had a culture of promoting workplace wellness and healthy eating agenda, it would go a long way to show that reasonable efforts have been made to avoid the employee gaining weight. Evidence that shows employee support could include subsidized gym membership, health campaigns, a workplace wellness scheme, an employee assistance program, anything that you can show was supporting an employee in their efforts to lose weight. How to deal with obesity. In the absence of a clear policy, managers will be lost without guidance. When you're dealing with absence or performance issues, most managers are on firm ground. They have previous experience of dealing with these issues, and the company policy available to them helps them manage the situation. In conjunction with HR, they can deal with the problem using a defined management tools such as formal hearings, performance improvement programs, disciplinary hearings, etc. When dealing with less common issues, the manager is more likely to feel out of their depth. Examples that I've found, certainly in the workplace, are dealing with body odor and or appearance, dress code issues, stress, and particularly weight. In the past, many issues caused problems, but the managers are finding that company policy covers many more areas than was previously the case. So there are now clear policies on sexual intimidation and misconduct, bigoted or racial behavior, and stress in the workplace. I'd say in the last few years these are areas that have advanced significantly. And dress and conduct codes are also clear. Case law and industry standards help drive forward improvements and better definitions of acceptable standards. In time, do you think obesity could be the same? It already appears that it was socially acceptable to attack smoking and smokers. Could obesity end up the same? Do you have a clear policy on obesity in the workplace? In relation to office seating, ask the employees if they are heavier than 18 stone or the rating that you believe your furniture to be. One client emailed all their staff in a call center and explained that if a person was over 18 stone, they were likely to require a replacement office chair. Only a very few people came forward to request formal DSE assessments. I think we estimated there were 6 to 8 people who would exceed 18 stone, and I think there were 2 replies requesting new chairs. Some were very likely to exceed the limit, but no action could be taken without firm evidence. If the employee won't admit to a weight problem, can the employer be blamed if an item of weight-bearing equipment fails? In health and safety, apathy and inaction are never the answer. You should never give up trying to prevent an accident. In the absence of case law, the solution is unclear. In America, where health insurance has got some spiraling costs, many employers now routinely weigh their employees, with up to a fifth having punitive measures to deter weight gain. So where will we be going in the future? Colleagues in HR will worry about the civil litigation involved if we label an employee as fat, and how the European Court ruling would force member states to view obesity, with potential changes to the Equality Act. As a health and safety professional, I always look at the risk. Under health and safety law, the employer has a duty of care and the employee must cooperate. The legal term, as far as is reasonably practical, will apply to efforts to prevent accidents from happening. How do you feel the Danish courts would view Mr. Kaltoft's case if he'd been dismissed on safety grounds? A 25-stone man falling on a child would be a very real hazard, with the potential tragic outcome. If he was a child murderer who could not work near children, would it be fair to say there was no reasonable adjustments that could be made? Thank you very much indeed for listening to this Posturite webinar. Over to Catherine.
Thank you very much, Graham. Gosh, there's quite a lot of food for thought there. We've got a few questions that I hope you'll be able to help us with. I think so. The first one is, do you think we're going to get many criminal prosecutions with this?
Certainly, I think that there is the potential for a criminal prosecution if the person had used a piece of equipment that was clearly defined weight loading. I've investigated 2 serious accidents where people have fallen from ladders, and in both cases they were exceeding the weight loading of the ladder. And in one case, I believe it could still result, the HSE do take a long time to think about this, but it could result in a criminal prosecution for providing the wrong equipment. So if an employer knew or knowingly gave a light-duty ladder to someone who was obviously obese, yes, there is a prosecution potential there.
Thank you for that. I think there's something that we would all feel here is that, do you have any tips to approach somebody who is obviously obese, who is obviously sensitive to it, about carrying out a PEEP or about helping them? Any sort of like sort of personal quips really on that one?
Yeah, it's certainly something that you would need to do in a private setting. It would be very unfair to single this person out in an open plan office or a workplace and to then make it very clear to their fellow employees that you are having to deal with their weight problem. It can be addressed at one-to-one meetings, at performance review meetings, that sort of occasion when you're looking at the general work of the employee, or if you feel that it has come a time when you need to discuss the issue with them. It's never going to be easy, but doing nothing, unfortunately, is not an option.
I mean, from my personal point of view, I actually found when I've actually raised this with people one-to-one in a quiet setting, actually it's not been a problem. The fear of it has always been far worse actually than actually doing it.
I attended a course about 2 months ago on approaching difficult conversations, and that point came up again and again, that people will put up a barrier because they believe the outcome will be worse, and when they actually get round to it, it turns out to be a lot easier.
Excellent. Oh gosh, they're coming in thick and fast now here. There was a question, let me just hear. Would it be possible, do you think, to add a question regarding weight into a risk assessment, or would this be something that should purely be in a pre-work health questionnaire or something like that?
Well, of course, as a pre-work health questionnaire, you can no longer use that as a reason not to employ somebody. So you would be aware, presumably at the interview stage, that there could potentially be a weight problem. Whether you would be able to decline to give employment, I think that in some instances where the work would require somebody to be very fit and active, you could decline and still be on safe ground. But if you make an offer of a job and then start to raise the weight issue, it's probably best done at the initial stages.
Okay, this is an interesting one. Okay, this is an interesting one. What sort of punitive measures do the US employers apply? I believe you mentioned that. And are these legal or illegal in the UK?
I don't believe they're legal in the UK. The punitive measures that I have come across through investigation of the subject are that the American contract of employment includes the statement that they can actually have punitive measures if an employee's weight begins to cause health issues, and it's linked very much to the fact that they provide health care as part of their contract. So they can put restrictions on that health care, or they can withdraw the offer of health care altogether. They can also, I believe there were instances of people's pay being, or not pay, but pay and promotion being affected by the fact that they were overweight. Whether any of these have been challenged in the US courts, I don't know, but it is very much linked to the fact that they think the healthcare is a benefit that is given to the employee, and if the employee abuses that, then it is a benefit that can be withdrawn.
Wow, well, I think on that complex ending, I think we'll leave it there because I'm conscious of time. But so can I just thank you very much once again for that thought-provoking coming up to Christmas webinar. I think that's one less sort of mince pie for me, I think. So thank you, Graham, for that. I just really want to remind everybody that the presentation will be available on our website as soon as we can get it up there, so you can listen again, and of course let your colleagues listen in if you think it'd be useful for them. We're also going to ask Graham to answer any questions that he can that have come through, and those will also be available on the website, his answers to that. Before I let you go for your lunch, there's a couple of things I just wish to draw your attention to. Our next webinar won't be now till January. We have a Christmas break. And on January the 16th, we'll be looking at mind mapping, looking at a business tool, and that'll be presented by Jamie McDonald, who's the Head of Client Development for Mind Genius. So I hope that's a topic you'll be interested in. And another thing I'd just like to invite you to is that Posturite have a showcase on the 26th of February, where we'll be having all our products and our staff available for you to talk to at St Martin's in the Fields in London. And details of that will be coming out in our Newswrite edition on December. So I think it's the first time I'll say this. I hope you all have a lovely festive season and Christmas, and look forward to speaking to you in the new year, and enjoy your weekend. Goodbye now.